Assalamu alaikum. Good evening. Hope you are well. Shoulder pain is a very common problem in patients who have diabetes. Not only can shoulder pain negatively impact a person's overall quality of life, but it also may interfere with activities of daily living. One of the most common shoulder disorders that are associated with diabetes is adhesive capsulitis. This is also commonly known as frozen shoulder. So, we should know how a diabetic patient can develop frozen shoulder. To know the matter very well, please stay tuned. I, Dr. Farhad Zaman, PhD, welcome you. Today, our topic is why diabetic patients develop frozen shoulder. So let's go to the topic, that is the why diabetic patients develop frozen shoulder. Frozen shoulder is a condition that is characterized by painful, progressive and loss of range of motion of the shoulder in multiple planes. That is, he can't move his shoulder freely different direction. He will feel severe pain when he want to move his shoulder in different direction. The typical presentation of frozen shoulder can vary, as well as the physical findings and the severity of symptoms, but usually patients will present the shoulder pain with any movement which is elevated by rest. That is, the pain will begin in shoulder movement, but when he going to resting position of his shoulder, the pain will go away. Pain can often be more intense at night and disturb his sleep. Patients can have difficulties with activities of daily living such as his dressing, bathing and household chores, and in particular anything that requires reaching behind their back, overhead, behind their back, overhead or across the body that requires across their body can cause increasing discomfort as the progress continues. Patient will also experience a progressive loss of motion, particularly in external rotation. Patient will feel most loss of movement in external rotation because of his front muscles become tight. As the front muscles become tight, front muscle of the shoulder become tight, he cannot do his external rotation. For the diabetic patient, it is generally believed to be the result of decreased circulation and the byproducts of the breakdown of excess sugars that penetrates the tendons and ligaments and cause the structures to become stiffer and weaker over time, leading to the symptoms of shoulder pain or frozen shoulder. That is why it is very important for diabetic patients to have a good control of their sugars and normalize hemoglobin levels. They have to check their diabetic level periodically and also hemoglobin level periodically to control or to avoid their frozen shoulder situation. This program is for your benefit and your family benefit also. Please share it to your friends. Our neurokinetic therapy is very effective in chronic pain or long-term pain or short-term pain solution. It is much popular in Europe and America to solve pain complaints without side effects. You can find your pain solutions here. So please stay with us and be updated. Thank you.